Aloha mai kākou and welcome to the Maunakea Lab. I'm Alika Maunakea, born and raised in Nanakuli on the Waianae Moku, and a professor at the University of Hawaiʻi, Mānoa at the John A. Burns School of Medicine. I'm also the principal investigator of Hawaii's first ever NIH-funded study on what we call social epigenomics. So here in the Maunakea Lab, we studied the epigenetic basis of disease development to enable prevention, which I feel is essential for holistically understanding and addressing health disparities in our community. One major challenge our community is faced with is diabetes, or in Hawaiian, mimikoko. While diabetes is increasing across the board, Native Hawaiians and Pacific Islanders as a group are burdened with nearly 2 times higher prevalence of diabetes and are 3 times more likely to die from it than compared to the overall population of the state. What's more alarming is that there is even earlier onset of diabetes among Native Hawaiians and Pacific Islanders than other ethnic groups, on average by 10 years. So not only is there a higher prevalence of diabetes in our population, but we tend to be diagnosed with it at a much younger age than other populations.
So what are the requirements to join our study? Our study is aiming at anybody that lives in the state of Hawaii ages 18 to 50. We are aiming at enrolling 2,100 people, so we need as much help as we can. When someone decides to join our study, they have to go to our website at highc.org, and then they have to enroll in there. You're gonna have to fill it up some information about you, and then you have a questionnaire that you have to fill it up. By the end of that, we're gonna ask you to choose when you wanna see us, either here at our university, where we have our clinical lab, or at specific events that we're holding in the state. We're gonna need to take some key health measurements about you. We're gonna need a blood sample, we're gonna need to measure your blood pressure, your height, weight, and your circumference. Besides that, we're gonna ask for a stool sample. We give a kit to you, you go home, collect the stool at home, and then either you bring to us or send to us by mail. Finally, when we get the stool sample, we're gonna give you a $100 incentive.
Some of the general benefits to study participants include learning about your own health. So in addition to the metrics that you provide us in terms of A1C and BMI, you also learn about your own gut microbiome composition. But more importantly, you're really contributing to a new data set in Hawaii that we've never had before in order to help us identify early indicators of diabetes risk before the disease occurs so that we can enable prevention for our community.
I think it's important for people to get data and be able to access that data for free.
One thing I want to know more about myself, but also I want to know more about the people in my community, and from the statistics and results from it, hopefully be able to learn more and be able to help in any way that I can.
I think the Mauliola study is important because it can tell you more about your health and how you can improve, or just like where you are in general, like with your health, because it runs in my family, and their like symptoms of it or side effects from having diabetes kind of ended up like sending them to the hospital, and it kind of got too serious to a point where my grandfather on my papa's side passed away from diabetes.
Centuries ago, I believe that Hawaiians not only understood epigenetics, but applied it to their daily lives. As an example, in Mary Kawenapuku'i's Olelo no Eau, she records a phrase, "I pa'a ke kino o ke keiki I ka la'au," which translates loosely to, "Let the body of the child be solidly built by the herbal medicines," or la'au. This was said of kahuna la'au lapa'au practitioners like my kupuna, who would prescribe certain herbs in the diet of pregnant mothers, with the idea that the constituents of the herbs would help support healthy development of the child during pregnancy. This would help prevent the child from developing adult onset disorders later in life. We now know that epigenetic mechanisms are likely responsible for this observation, so in some ways, we are relearning our Ike Kupuna in the Maunakea Lab and applying this knowledge to address health disparities in our communities where this Ike comes from. We invite you to participate in this study and really appreciate your kokua and support in helping our community.